The chairperson of the board of directors for the American Heart Association here in the Capital Region. I am joined by more than 60 advocates today who have traveled from all over the state of New York to be here. We are spending this day asking our legislators that all schools have cardiac emergency response plans in place. Specifically, we are asking that they support Senate Bill 4100, sponsored by Senator Tim Kennedy of Buffalo, and Assembly Bill 7013, sponsored by Assemblymember Michelle Solanges of Long Island. This led school districts to develop and implement a cardiac emergency response plan and to have an AED be immediately available to athletic coaching and/or training staff at the location of any school-sponsored practice or athletic event. At this time, I'm going to ask Senator Kennedy to come forward as the sponsor of this bill.
Hey, how are you?
Thank you. Thank you. Thank you so much for being here.
Yes,
Thank you.
Of course. Well, good morning, everyone. How are we all doing today? You all look brilliant and beautiful and handsome in your red. Apparently, I forgot the memo. Didn't get the memo. First of all, let me just thank this extraordinary group of individuals for being here today. There is a lot going on, and I really appreciate you giving me this opportunity to speak on a bill that I carry. I really want to start by thanking these extraordinary advocates. Linda Marino, cardiac arrest survivor from my hometown in Western New York, from Buffalo, East Amherst, New York. Also, Melinda Marie Nyack of Queens, whose son passed away at the age of 17 of cardiac arrest. We want her son's memory to live through our passion and dedication to getting this legislation over the finish line. To Dr. Sari Naidu, cardiologist with the New York American College of Cardiology, Ken Edmonds, Vice President of Public Affairs, and my colleague in government and the assembly sponsor of this bill, Mickey Solage. I want to thank all of you for your leadership and this group of supporters from all across New York State. They care deeply about doing the right thing in our respective communities, setting a precedent for the rest of the nation that we need to show the world that making these AED devices present and apparent in our schools and on location during athletic practices and games is simply the right thing to do, and it will unquestionably save lives. And I want to thank those that will share their powerful stories here today for sharing their experiences, their expertise, and being the strong advocates that they are. You'll hear a lot about why we're here, why we want school districts across New York State to take part in this plan. These school districts should develop a plan that will implement cardiac emergency responses to ensure that AED devices are immediately available to coaches and athletic trainers in schools and on location in school sponsors events across this state. But we're not pushing these reforms out of thin air. We're pushing them because we know that they save lives. It is a proven fact. When you have someone on the scene that knows CPR, they will help to save lives. When you have access to an AED device on the scene of someone suffering from cardiac arrest, it will absolutely save lives. For so many people that are here standing with us today, they have direct ties to individuals that have had cardiac arrest. I unfortunately, or fortunately, am one of those individuals. Back on March 22nd, 2022, May 22nd, 2022, just a couple of years ago, less than 2 years ago, myself and two other individuals at an event which was a real celebration of life for Zaire Goodman, a beautiful young man celebrating his 21st birthday 8 days after the May 14th massacre in Buffalo, when he was shot through the neck and was the lone black survivor. His mother, Zanetta Everhart, my head of diversity and inclusion, had a celebration of his life on that day as he turned 21 years old. And so we celebrated. And there was a woman that was there was a community advocate, her life dedicated to the people of Buffalo and Western New York, Marnetta Malcolm, who helped to plan that event for Zaire Goodman that day. And because of the true emotion and the raw community pain that we were feeling in that moment, and Marnetta, being the community advocate that she is, jumped into action for those 8 days leading up to Zaire's birthday event. And she suffered a health scare, a crisis, cardiac arrest. She died on the scene. For 10 minutes, her heart was stopped. And having a degree in occupational therapy and healthcare, knowing CPR, and being in the presence of others that did, a woman by the name of Tara Massenberg and a young man by the name of Mohammed Sambundu, a state employee. The three of us jumped into action and provided CPR to Marnetta Malcolm on the scene for 10 minutes. We happened to be at Canisius University, so I called for an AED device to be retrieved because I knew one would be on the scene because we were at Canisius. And lo and behold, the security officer, a few minutes later while we're performing CPR, got that AED device. We attached it. We continued CPR. We shocked Zanetta. Then the first responders arrived. The police and the fire department. You know what you do in CPR when you're providing CPR when the first responders arrive, right? You back away. You let the professionals jump in to action. And they did. They shocked her 2 more times. And with the same AED device that we had attached, and you know what? All of a sudden we heard her gasping for air. Marnetta Malcolm is alive and well and serving the community that she did her whole life today because there were people on the scene that knew CPR, and there was an AED device on the scene that helped to shock her heart back into action. And we're so proud that tomorrow she will be honored by the American Heart Association out in Buffalo, New York, because of everything that she has done for the people of our community. So I'm proud to sponsor this legislation because I know it will keep our children safer, both on the athletic field and really on all of our school campuses across New York. This legislation is a no-brainer. It's going to save lives. It's absolutely worth it. And we intend to make sure that this policy gets enacted into law because of these amazing advocates that have come here today to advocate on its behalf and to save lives across New York State. Thank you for allowing me to say a few words. Now I have to go present a transportation budget to my Democratic colleagues, but I'm so grateful for all of you. Thank you all. Appreciate you all. Let's get this done. Are you ready? Yes. Thanks, everybody. Thank you so much.
Thank you so very much, Senator Kennedy. This legislation is necessary to help prevent deaths from sudden cardiac arrest. Each year, more than 356,000 people suffer sudden cardiac arrest outside of a hospital. The percent to get the immediate help that is needed, and among children, we have 23,000 experience of our children that experience a sudden cardiac arrest outside of a hospital each year. If a victim of sudden cardiac arrest receives CPR, their chances of survival double, and in some cases, triple. As an educator of 36 years, a past teacher, building administrator, and the retired former superintendent of the City School District of Albany, I know firsthand that schools are gathering places for the community. On any given day, there are meetings, plays, athletic events, continuing education courses, adult sports leagues, and fitness classes that bring many people into our schools. Having a cardiac emergency response plan and having an AED available can and will save lives. The American Heart Association passed the CPR in schools law and was instrumental in the passage of Lewis's law requiring AEDs in public spaces. We are continuing that work by making sure that our schools are prepared and should have a cardiac emergency plan so that they are prepared if these situations happen. At this time, I would like to bring forward to the stage Mr. Ken Edmonds, who is here from the NFL to share the importance of the Smart Heart Sports Coalition. Mr. Edmonds.
Good afternoon. My name is Kenneth Edmonds. I serve as Vice President of Public Policy and Government Affairs for the National Football League, and I'm pleased to be here with the American Heart Association and other advocates and allies of the Smart Heart Sports Coalition. Following the life-saving response to Buffalo Bills safety Damar Hamlin's catastrophic injury and his inspirational recovery, the NFL helped to lead the launch of the Smart Heart Sports Coalition in March of last year. The coalition includes major sports leagues and organizations, as well as leading patient and health advocacy groups across the country, nearly 40 stakeholders in all. We have come together to advance a simple but essential goal: to save lives. We want New York and every state across the country to adopt 3 evidence-based measures that prevent fatalities among high school and school-aged athletes and others who experience sudden cardiac arrest. The same 3 core elements of the response that saved Damar. These core elements are clearly marked AEDs at or within minutes of each athletic venue where games, practices, and competitions are held, an athletic emergency action plan or cardiac emergency response plan that is tailored to each athletic venue, posted, widely distributed, and regularly rehearsed, and education in CPR, including AED use for coaches and other key personnel. If adopted, these core elements will save lives. And the measure we've gathered here today to support does just that. And as you've heard, specifically, the measure amends current law by requiring schools to develop and implement cardiac emergency response plans. SERPs lay out the specific steps that need to be taken and by whom immediately following a cardiac arrest or a similar cardiac emergency at a school site or a school-sponsored athletic event. If passed, this bill will make New York school communities, especially places where young people play and compete, safer, more resilient, and better prepared to respond to a cardiac emergency, preventing avoidable tragedies and saving lives. We think that's a winning game plan for young people and school communities across this state.
Thank you, Ken. And I want to mention that the American College of Cardiology also supports this legislation. We've talked about the statistics around sudden cardiac arrest. However, behind every statistic, there are very real people that represent those numbers. Melinda Murray-Nyack of Queens knows firsthand the devastating loss that sudden cardiac arrest can bring. Melinda is a lifelong, long-time advocate for CPR and AED use. She has helped us pass the CPR in schools law and has created a foundation that educates, promotes awareness, and creates legislation that effectuates change in screening, diagnoses, and immediate treatment of sudden cardiac arrest. Melinda, will you please come forward and share your story?
Thank you. CPR in schools is very important to me and to many others because had someone known what to do when my son collapsed, maybe he would still be here today. When Dominic collapsed at the age of 17 while playing basketball, no one started CPR right away. They ran right past the AED that was just outside the gym door, and minutes passed, precious minutes passed, that would have most likely saved his life. In fact, the AED was not used until the emergency responders arrived. So on October 5th, 2009, I lost my only child. But I didn't want what happened to me to happen to another family. CPR can be trained, anyone can be trained in CPR because anyone can learn how to save a life. It's as easy as call, push, shock. We want it to be part of everyone's vocabulary, as simple as stop, drop, and roll. Anyone can do it. There should be no child's heart left behind. So in memory of Dominic and the many other hearts silenced by sudden cardiac arrest, for the survivors like myself, a mother of someone who lost their only child, please, we implore you to support the cardiac emergency response plans. Ensure that resources are made available in schools so that CPR can be taught to the next generation of lifesavers. And as they are taught, they will teach others and it will continue. Thank you.
Melinda, thank you so very much for sharing your story. We are all proud to honor your son Dominic by working to pass this legislation. We also have Karen Akampora. Is she here? Okay. Could you wave? Hi. We are so very happy that you are here with us today. Karen's son, Louis, also passed away of sudden cardiac arrest, and she has worked tirelessly on CPR and AED legislation. We thank you for your work, and we appreciate you being here today. Thank you. We are also joined by survivors of heart disease and sudden cardiac arrest. One of them is Linda Moreno of East Amherst. You heard Senator Kennedy speak about her earlier. Linda is a cardiac arrest survivor and a member of the 2024 Go Red for Women class of survivors, a group of ambassadors sharing their story across the country. Linda, please come and share with us.
Thank you so much for having me today. Here from Buffalo, New York, to help spread awareness, let me tell you and share a little story with you about my cardiac arrest journey. I was driving my car down a very busy 4-lane highway on a fall afternoon. My 2-year-old daughter was in the backseat of my car when I suffered my cardiac arrest. A gentleman was behind me in his car, thought it was odd, my car was going so slow. Pulled up next to me, saw I was slumped over, my daughter was crying in the back seat. So he drove off to the side of the road, parked his car, and got out and ran my car down. It was then that Bill and Peggy came across 4 lanes of traffic. Bill's the one that got me out of the car and performed CPR. He's a veterinarian. My lips were blue, I had no pulse. Meanwhile, a sheriff was nearby, and he arrived on the scene with an AED. That device had to shock me multiple times that day. So the story is full of many miracles, but we hear some consistency today. You know, administer CPR, the AED, calling 911, all of these steps are so very critical. My journey has been a long one. I'm up here today, though, I think, mostly as a mom of now, almost 9 and 11-year-old, both of who are genetically positive for hypertrophic cardiomyopathy, the same condition that caused my cardiac arrest. So I'm here today to bring support. As a mom, first place I look everywhere I go, where's the AED? Sleepless nights for my husband and I thinking about it. But my message is clear. Quick, swift action by complete strangers that are now my heroes. I say, you know, care like Chris, who ran my car down, be like Bill. He jumped in and performed CPR. That's my message today, and I want to thank you so much for having me. I also want to thank Senator Kennedy and Assemblymember Solage. Please pass this legislation, and thank you.
Thank you to all of our speakers today and our advocates who are here. This is the centennial year for the American Heart Association. We are 100 years old. One of the many things that we are immensely proud of is that we created CPR and we update the guidelines every 5 years. We are working to build a nation of lifesavers who can respond to an emergency and perform hands-only CPR. We call on the state legislature to make the cardiac emergency response plans a reality. We urge anyone watching or listening to contact their legislator and ask for support of this legislation. Now, Mike Smith from the American Heart Association will lead us in a hands-only demonstration. Media, we will be around, so if there's someone that you would like to speak with, please make sure that you contact us. And thank you for your support. Let's continue to build a nation of lifesavers on behalf of the American Heart Association. Remember to live fierce. Thank you very much.
All right, well, thank you very much, both Linda and It's a shockable rhythm. Everybody's to stay clear. The machine is winding up with energy. The machine will flash the button, and right before we shock, we clear one more time. We shock, and we go right back into CPR, starting with compressions. Internally, that AED is counting down 2 minutes, and at 2 minutes, it's going to say, hey, stop CPR, I want to check the person again, see if they need another shot. And this is as simple as hands-only CPR. Call 911, push hard and fast in the center of the chest. If you have other folks around, send them for help and get the AED. And in real life, we would keep going, but for our demonstration purposes, we can stop. Excellent job.